right, we'll go ahead and get started. I think I've let everybody in. I'll double check the waiting room in a second. I think everybody's in. So welcome to this week's Current Topics in Science. It is my pleasure to introduce Leslie Langevin. She is a dietitian and she is the co-owner of Whole Health Nutrition. And she's also the author of the Anti-inflammatory Cookbook. So she's going to talk to us a little bit about her background, but also get us up to speed on some research she did for her book. So welcome, Leslie. I'll hand it over to you.
Awesome. Well, thanks for having me. And hopefully today you guys will just hear about what a dietitian can do more in fun practice, because it's kind of like I get to talk about food all day with science in a fun way. So it's actually kind of a fun job. And a little bit about like anti-inflammatory nutrition and then histamine, which is something that not a lot of people hear about. So I'll give you guys all sorts of different background on that. So looking through, so as Emily said, or Dr. Tarleton, I'm sorry. I went to UVM for my undergrad degree and my graduate degree. And to be a dietitian, you have to do an extra internship afterwards. So it's kind of like a mini residency. So you get to shadow different practices, and people can work in the community realm and work with nonprofits for like food access. People do outpatient counseling, which is what I do for my day job. So I talk to people about how to make personalized meal plans for themselves, about sports nutrition, weight loss, work a lot with eating disorders, and pediatrics for picky eating, which is really fun. And our practice is located in Colchester, but we've been doing a lot of telemedicine, I think, as everyone else has been. And then I wrote this cool cookbook because it was always kind of a dream of mine to make a cookbook, but I developed an inflammatory condition about 5 years ago, and that was the whole reason I did all the research for my book. So that's what I'm going to share with you guys. So this is called mast cell activation syndrome, or histamine intolerance is another name of it. And I feel like if any of you have chronic illness or chronic illness in your families or autoimmune illness, most people do just tons of research, right? To figure out, wow, what can I do to feel better, first of all, because usually you're not feeling very well, or is this going to stick forever? And I firmly believe that food can make a really big difference. So in being a dietitian, you learn about the science of how to help people with diet. So it's not about cutting calories all the time. It's about actually using foods that have healing properties like ginger or different herbs, which we'll talk about today. So food actually can make a really big difference in your wellness. So this is just a fun quote, right? Let food be thy medicine and let medicine be thy food. So before we had lots of pills, we used herbs and we used food for medicine, thousands of years ago. So there is some evidence also coming out for all of these treatments that have been used for thousands of years. So we'll look a little bit at the science behind some functional foods as well. So this is just a really detailed chart. So don't worry about all the little words in there, but have you guys ever heard of mast cells, or do you know much about inflammation? I'm going to kind of scroll through. Raise your hand if you've ever heard of inflammatory conditions, mast cells. Okay, so inflammation, I've got a couple of hands. Sorry, I'm scrolling through finding hands. Okay, so we've heard of inflammation. And if you guys have questions, just post them at the end. So I'll just try to give an overview. So my favorite way to describe inflammation is like when you get a cut. So if you get a cut, you typically get some redness around it, right? So that is our body's good way of doing inflammation. So if you look at the top of the diagram on the right side of your screen, let's pretend we got a trauma, we cut ourselves, right? This is the best example that I like to use. All of our helper guys, we have our platelets that are going to clot our blood. We have mast cells that secrete some helpful and some not helpful mediators to help with healing the wound. We have white blood cells that come out, right? So our body does this all on its own without us knowing, but sometimes that inflammation can become systemic. So when you have conditions like heart disease and diabetes and even obesity, the body is in a chronic state of inflammation. So what used to be this little tiny trick we used to maybe heal our skin, as the best example, or a very visual example, we kind of had this chronic inflammation that goes everywhere. And so you might think of arthritis, right? Arthritis is a really big inflammatory condition where people have pain. So if you look at here, we pretend we have a trauma or maybe lack of sleep, poor diet, whatever it might be. All of our helper guys, our mediator cells, are trying to help and heal us up, but sometimes they give us inflammatory helpers and sometimes they give us anti-inflammatory helpers. So it just depends on how long the inflammation is going on for. So over time, if you have chronic inflammation, you can develop pain and discomfort, right? So those are things that we can start reversing with different things like better diet, right? Better exercise, better sleep, better self-care, and then the foods that we're eating or functional foods. So mast cells are what I'm highlighting today, just because it was the core research of my book. So these are our immune cell helpers, right? So don't worry about the little words, the cytokines, those are inflammatory molecules that people think of. And with COVID, they're talking a lot about those cytokines, right? When the immune system's going overactive, right, is what's causing a lot of people to have really bad side effects from COVID is that cytokine release. So those are things you've probably, read in different articles related to COVID-19, but that's your immune system just kind of going crazy, right? It's really going into aggressive mode to heal. But it doesn't always lead to positive outcomes when it gets a little too aggressive. So we want to try to manage that. So those mast cells that release these cytokines, they also release histamine. And so you hear of histamine in allergies. So when you think of an allergic reaction, the mast cells, they go bouncing around. They go a little crazy and they release histamine along with all these inflammatory molecules at the same time. So that can lead to runny nose, right? That can lead to throat closing. That can lead to dry, itchy eyes, rash, hives, whatever it might be. So in mast cell activation, which is what I want to talk to you guys about, is these mast cells, they go a little crazy. And you either have too many of them or they're just a little overactive and they're kind of shaking all the time, releasing too much. So that's very uncomfortable for people who have this condition. So I'll show you some of the symptoms coming up. So mast cell activation. So I was unlucky to develop this. And the way it presented is I had anaphylaxis recurrently. So I had a life-threatening allergic reaction for no reason over and over and over and over again. Like that is a really terrible experience to have, right? So people also get this flushing, and this is from that histamine. So you get bright red in your cheeks. Again, the normal allergy symptoms, right? Nose, running, throat itching, swelling, hives, and eczema and atopic dermatitis. I'll talk to you more about those because there are genetic reasons why people might have more linking with a histamine intolerance or more likely to develop this type of condition if you have eczema and atopic dermatitis. Some people faint because your blood pressure gets really wonky and then it affects your gut. So you have mast cells everywhere in your body, your brain, your stomach, your skin. So that's why you get symptoms everywhere. Then it affects your bones. You can get bone pain. You can get osteopenia. So you have weakening of the bones. Fatigue is big, right? If you know anybody with an inflammatory condition or autoimmune condition, fatigue is huge. Like fibromyalgia is another really common one that people can barely do one or two things in the day. And it's from the inflammation cascades set off in their body. Migraines are also another big sign of this, uterine cramps, any mood disorders, anxiety, depression, and then interstitial cystitis, which is basically inflammation of the bladder. It causes people to have to pee all the time, or it's very painful. You have pressure in your pelvic area. So not fun things, right? Like some of these are pretty minor. You're like, oh, I've got allergies. That's no big deal. Good. You just have allergies. If you have a list of half of these things, your mast cells might be a little overactive, or you may have more of this histamine intolerance. So this is a relatively new diagnosis. So mast cell activation is actually a real diagnosis in the medical community. Histamine intolerance is not. So that's why I wrote this ICD-10 diagnosis. So if you go to a doctor and you say, I have all of these things wrong with me, they're just going to say, oh, you have allergies, you have IBS, irritable bowel syndrome, you have I don't know, hives, right? For no reason, right? So they might not put it all together because it's a very new diagnosis in the last 10 years or so, and the research is still coming. So a lot of people in the area, I work with a lot of patients who there's a few providers coming up in the area who are more specialized in this that say, oh, wait, you might have this. Go see Leslie. She can help you with diet, and maybe you won't be as sick when you eat your food. That would be great. So mast cell activation is the real diagnosis that a medical professional could use to diagnose someone. And it's having excess mast cells, right? Those guys that are going a little crazy or overly active. So either have too many or they're kind of going all over the place doing too much. And they're going to release histamine and tryptase and heparin. And these are all things that are inflammatory and cause symptoms. So you need to have two or more basically things wrong with you, right? You have to do two more organ systems. So if your gut's off and your skin's off, that's two organ systems. Or if you have migraines, that would be another example of it. You have to have some values elevated in your lab markers, and then you have to respond to medication. So if we have too much histamine going on, what do you think the most useful medication is for someone with a histamine problem? Since I can't read lips and or see half of you, I see two of you, I will tell you it's an antihistamine, right? So, that's a really common medication, and most people respond with a decrease in symptoms when they're given an antihistamine or an H2 blocker like famotidine or ranitidine. So you have histamine receptors in your stomach too. So those are primary medications that if people say, oh my God, I feel a little better on an antihistamine, it's because it's blocking the histamine the body's making too much of. And that's just medication aside. There are foods we're going to talk about that have histamine too. So this is a whole big other pillar that is why I wrote the book, so that people could kind of learn about what this will do. So histamine intolerance is, both of these are brought about for reasons we don't quite know, but the histamine intolerance is more thought to be related to the inability of two of your enzymes to function. So if you think back to biology, right, enzymes are kind of your workers in your body. They make reactions happen. There's an enzyme called DAO and one called HNMT, and these guys process out histamine. So some people with eczema, as an example, or atopic dermatitis have lower DAO levels, and found that out by doing my nice literature review for my book. So there is some genetic relationship into developing things. And then triggers that can set mast cells off are heat, cold, fragrances, cleansers, food, travel, vibration. So when you're riding in a car, stress, any illness, taking aspirin or opiates or antibiotics or alcohol, getting stung by a bee, sunlight, pressure, fatigue, exercise, and temperature change. So you can see how you'd be a very uncomfortable person if you couldn't even take a shower without getting hives, right? That would be a terrible thing. That's super common in a lot of these patients. Or getting rashes. But if you know someone who says, oh man, I can't handle perfumes, or I can't even be in the room with a cleaner, right? Like that sends me through the roof. Those chemical sensitivities also kind of line up with histamine intolerance or mast cell disorders. So it's just a common presentation in a lot of people. So if you know someone with any of these things, maybe there's a label for what they have, or medications or diet that might help them. Okay, so these are the enzymes, right? So you have histamine and methyltransferase, HNMT, and this is found throughout the body. And this helps break histamine down. So if you're making too much of it or you're eating too much of it and your enzymes aren't working well, you can't break it down. So you get a surplus. So your bucket fills up and then it kind of spills over into these symptoms. So that's where the diet stuff will come in. The diamine oxidase, the DAO, is typically in the gut. So people with irritable bowel syndrome or irritable bowel disease, they have altered levels of DAO enzymes. So it's not even just that it's the genetic predisposition. It is the fact that their guts are compromised, right? Their cell walls are not happy. They are not making good enzymes in their mucosal walls. So a lot of these patients will develop other symptoms like allergies, as an example, or migraines. And those are all things that we can help with diet. All right, so I found all these beautiful pictures on Pexels, right? The beautiful free picture website. So this is like the most glorious image of, it's beautiful, first of all, but it's really high histamine foods. So, the majority. So histamine foods, there's inflammation and then there's also histamine. So my book kind of layers on both because you have to functionally kind of decrease inflammation with diet and decrease the histamine in your diet at the same time. So foods that are high in histamine are things typically that are aged. So if you think of pepperoni and sausage and cheddar cheese and Parmesan cheese and even yogurt, right? A very healthy food, yogurt, or pickles right here on our picture, condiments, right? With vinegars in them, those are also aged. So if you're intolerant to a lot of these foods or bacon or things like that, you might ask yourself, maybe I have a little issue with histamine. Maybe my body doesn't process it as well as, the person sitting next to me. Inflammation, on the other hand, so histamine and inflammation kind of go hand in hand, but the traditional anti-inflammatory diet limits things like refined grains. So like white flour, you have a lot of it, it can be inflammatory, or a lot of white sugar, that can also be inflammatory. Things that are high in omega-6 fatty acids, which there's lots of different types of fatty acid types, but omega-6s typically come in vegetable oils. So if you eat a lot of fried foods or baked foods or snack crackers or things like that with vegetable oils, that will increase inflammation in the body. And then we live in a world where we have food additives in everything, right? Unless it's a whole food where you're like, this is an apple. Great, it's an apple. I know it's an apple. It might have some pesticide on it, but okay, at least it doesn't have red food coloring and MSG and yeast extract and natural or artificial colors and flavors added to it, right? We pump all sorts of stuff into our food supply. So these things are also inflammatory, right? Think of like 1,000 years ago. Were we eating MSG and red dye number 4? No, right? Our bodies are not necessarily ready for all of this new stuff. So the veggies that are naturally high in histamine are avocados, again, a very healthy food, right? But they're high in histamine, spinach, eggplant, and tomatoes. And then the fruits that are naturally high are strawberries, raspberries, citrus, and pineapple. So the whole purpose of what a dietitian would do is typically use elimination diets in practice. So if you have someone with irritable bowel syndrome, we would give them a low FODMAP diet. So it changes the carbohydrates in the gut to help decrease symptoms, and we know that it works. So same thing with histamine. We try an elimination diet, see how symptoms decrease, and then you add foods back. So that's typically how a dietitian would process or work with someone if they were trying to change their diet in a way, just so you kind of know what we would do. So these are foods that are typically very well tolerated and anti-inflammatory in nature and can actually help the body reduce some of these inflammatory symptoms, regardless of whatever type of inflammation you have in your body. So most veggies are a really good thing, right? So eat tons of vegetables, and it's not only because you get vitamin C, right, or vitamin A. We know that every color of every veggie is rich in phytonutrients, right? Or antioxidants is another good way to say it. And every color gives us a different benefit. So like red in watermelon has lycopene, which is good for like preventing prostate cancer and good for heart health, right? And the greens are also really good for having your liver help you detoxify stuff. It activates one of the enzymes in your liver, so you can actually break down any medications you take or any byproducts that you get in with your food. So the color of the food really makes a big difference. So think of eating as many colors as you can every day. And then this is my favorite one, eating 7 to 9 servings of fruits and veggies a day. So that is what's recommended for an anti-inflammatory diet. And like, what are we recommended at? 5 a day, right? That's like the healthy diet is 5 a day. That's like, I would say, to prevent nutrient deficiency. If you're looking to optimize your diet for decreasing inflammation or improving health, it could be 7 to 9 servings a day. So half a cup of cooked veggies is a serving, or 1 cup raw as like a comparison, or for fruit. So if you have a salad a day, a smoothie, you could totally get there, right? Or like 2 cups of cooked veggies at dinner. So it's relatively doable. You just eat more veggies is always the bottom line. I think every dietitian is always saying, please eat more vegetables. It's not fancy, but it really works. It's a good thing. So lean meats, right? Like chicken and fish are really good ones. Again, we don't want like tuna fish sitting in a can or fish that's sitting out for a long time. Histamine's actually created in things that age, right? We said that with like the aged meats, but think about leftovers. So if you made like a chili, meat chili, and you left it sitting in your fridge for 5 days, bacteria in the meat, in the chili, we know bacteria always replicates in leftovers, right? Makes histamine. So eating 5-day-old chili, you're more likely to have a reaction if you're a sensitive person than freezing it. So usually we recommend people freeze their leftovers, especially if there's meat in them, to reduce the histamine production. So eggs are still good. Eating free range if you can, you get more omega-3s, which are the really good fat that you want. And that's the other big piece of things. So for, how we said omega-6s were inflammatory, omega-3s are anti-inflammatory. So eating more fish is a good thing, right? Eating seeds are a good thing. Eggs, which have omega-3s in them, are also good. And chia seeds, right? So chia seeds are a great addition for omega-3s, and they're easy to just throw on different things. Whole grains are still good, right? You don't have to cut grains out. Whole grains are still really, really healthy. And in all of the studies, they show that they're helpful for decreasing inflammation. We just want them whole. So like whole oats, not stripped away, white flour. And then using a little bit of dairy to taste, but fresh, right? Like mozzarella would be okay, just a little bit fresh, but keeping it to a minimum. A lot of people do find that dairy is inflammatory and makes their condition worse. Olive oil is like hallmark number 1 oil to use. So if you're gonna use any cooking oil, use olive oil, and don't cook it to super high heat. So kind of cook it over medium so you get the most benefit from it. Coconut oil is another really good one, and you can cook that one to a higher heat. So if you're gonna change any cooking practices, those are good ones to do. You can even get chia seed oil or flaxseed oil as like a fresh oil to put on top. If you're like, ugh, I don't want to eat chia seed, I don't want to eat fish, you can actually buy chia seed oil and it'll boost up your omega-3s, and you can put it on salad or put it in a smoothie. So it's a good little booster. And then for condiments that don't have vinegars in them, like that's really hard, right? It cuts out ketchup and cuts out barbecue sauce and mayonnaise, like when you look at the histamine aspect of things. But doing, fresh and dried herbs and garlic and lemon juice and maple syrup, like those are better choices. So these are all ways to help, I guess, decrease your inflammation and hopefully don't feel like you're starving at the same time. So that's our job, right, as dietitians, to say, here's all the things you can eat while eating all these really healthy foods. And that was the whole reason I wrote my cookbook too. So I put a research section in the front. It's like 40 pages long because I wanted to help educate the medical community on mast cell activation because it's not well known, and histamine intolerance, and then the relevancy of diet and the low histamine diet using anti-inflammatory properties to help reduce symptoms. So that was the whole reason that we wrote the whole thing. And then I put a bunch of recipes in there because people are like, what the heck do I eat? So do you want to stop and answer questions? I see a couple have popped up.
Yes, I can read them to you.
Okay, I'm just pulling up. Okay.
My chat's a little bigger, so.
Okay, well, I see a middle one from Nicholas. So what if you have many allergies and have eczema, but don't eat a lot of veggies and don't have a great diet? Is that bad for my health? So I would say we could optimize your health, I think is the best way to put it, right? So we could come up with little strategies to hide it in. So if you're like, you could buy a shelf-stable, wait, you know what? I'll tell you my favorite one. Okay, so I work with picky eaters a lot. I work with kids a lot. So my favorite trick is the V8 Fusion juices that are fruit and vegetables combined. And in 8 ounces, you get 2 servings of fruits and veggies. So you don't get fiber, which we know is a really good thing too, but you can always add fiber from something else. But the V8 Fusion juice might be a little trick for you to get more fruits and veggies. And you might find your eczema reduces. And you might find your allergies also reduce as you increase your antioxidants. Or look at your histamine load too. So if your histamine load is really high, it might be prompting your allergies. So obviously if you're allergic to dairy and you get an anaphylactic reaction, like don't eat dairy for sure. But like if you have runny nose, like as a seasonal allergy symptom, for example, we know that something called quercetin in onions and apples is a good example. Quercetin is actually shown to reduce allergy symptoms, and we can get some of that from food. So all really good things. So yes, I would say I always recommend fruits and veggies, and you might optimize your health, but try the V8 Fusion juice. That might help. Okay, so there's a lot more coming in.
Okay, I can start reading.
Tell me. Okay.
Yeah, I can start reading. Okay. I was born with dermographia, and my understanding of its diagnosis is that my skin is technically allergic to touch. If I scratch an itch or sit on a scratchy couch that rubs against shoulders, I will get raised red lines, inflammation, and hive-like welts. Does this condition relate to inflammatory molecules?
Yeah, so the dermographia is actually really common in people with mast cell or histamine intolerance. So like one of the tests they do is they literally like scratch your arm and they say, all right, does it turn red and swell? And that's literally one of the things that doctors will look at, is if you actually turn red and swell. So I would look at the histamine foods in your diet. If you eat a lot of aged foods, maybe try, cleaning it up a little bit for a little bit of time, and see if you can reduce your sensitization, because your body's overly reactive, I guess is a good way to say it. But yes, that could maybe be improved a little bit by looking at the histamine aspect of things.
Sweet. Okay, as someone with fibromyalgia who eats a lot of vegetables and fairly healthy, but I still struggle heavily with pain, should I be more restrictive with my diet to optimize the effects?
Yes. So everybody's fibromyalgia food tolerance is a little bit different, but I will tell you the common core. Gluten often affects a lot of folks with fibromyalgia. So I usually recommend trying a gluten-free diet as well. I didn't actually mention that. I recommend that in my book too, is trying a gluten-free diet. If you're going to go on an elimination diet, you might as well do it all at one time and then add stuff back. So there's no point in doing multiple, and stress yourself out for months and years. Do one elimination diet, see how you feel, and then add back. So I would definitely recommend a gluten-free diet. And I would say, you guys will get my email afterwards. So I have a practice of 4 dietitians that I work with, and we all can help with all these things too. So if you want a personalized appointment, you are welcome to reach out, because we might be able to find any holes in what you're eating. So I'd say gluten-free, up your veggies, fruit for sure, and omega-3s is the other big gap. So we'd want to look for omega-3s to see if that's helpful too. But you're right. It's kind of look at that, take that slide of all the really good ones to eat and try to maybe stick on that one. But yes, you guys can definitely reach out to our practice too.
Cool. How would this work for someone who is vegan or vegetarian, being that they don't eat meat or dairy products?
Yeah, so a vegan diet's actually a wonderful anti-inflammatory piece of things, right? So as long as you do it correctly. So vegan diets, when done right, you have lots of beans, you have lots of complementary proteins with whole grains and beans together, I guess is the best example, and veggies and fruit. If you're, I guess what they say is not a good vegan, I don't know what the term is, but you eat a lot of bread and crackers and just say, there's nothing here, I'll have some hummus with my crackers, right? You eat a lot of white stuff, then I'd say add more color, because that can definitely be helpful. You do not need to eat meat to be anti-inflammatory. I'd say the omega-3s is the only gap you'd be missing. So add chia seed and chia seed oil, those would all be really good things if you were vegan, and seeds, hemp seeds, all those things. Yeah.
Cool. Okay, next question. How is Abstos exposure, or I'm going to skip this one. Emily, I'm going to pass it off to you. Are there alternatives to meat that are just as healthy for vegetarians or vegans?
For vegetarians or vegans. Okay, so my favorite is the cleaner pea protein items. So there's still some histamine, right? Because it's an aged protein thing. But from a protein perspective, for someone who maybe isn't dealing with histamine issues, I love the Dr. Prager's pure protein burgers. They're super clean. It's pea protein and beets and I don't know, a little flavor, natural, garlic and stuff like that. So that would be the recommendation I would say for the non-meat items. I love those ones.
Cool.
So I can do some questions, and just let us know, Leslie, when you want to just jump back into your presentation again.
Okay, we've got plenty of time. So let's maybe do 5 more minutes of questions, and then we'll finish the end, because I want to show you guys all the functional food stuff, because it's just really cool to think that your food can actually make a really big difference in how you feel. So 5 more minutes.
We'll do a couple more, and then I'll pass it back to you, and we can always come back to them.
Okay.
Okay, so how has asbestos exposure, mesothelioma changed what we know and how we treat inflammatory disorders?
So those, well, right, like, so asbestos is a carcinogen, right? And so if you have mesothelioma, you had basically a cancer brought on by a pretty intense carcinogen, right? So cigarette smoke is another example of a carcinogen. So because you've had such a big exposure to something that was very inflammatory, right, or carcinogenic to your body, we're not necessarily going to be able to overturn that with diet, right? Like I'd say follow treatments of your doctors for sure. But eating a lot of fruits and vegetables, if you look on the National Cancer Society or Breast Cancer Society, they really love highlighting what phytonutrients do in food. So look at eating tons of fruits and vegetables, especially the purples are really good and the greens are really good. But right, so with the mesothelioma, that's going to be a hard one to overturn. So maybe you can complement with using a lot of good foods in your diet, but definitely you need some cancer treatment with that too.
And how would a pescatarian diet be smart for someone with these illnesses?
Yeah, pescatarian's great, right? So you're just basically eating a big plant-based diet with fish. So that is a very healthy diet, and you're eating a lot of anti-inflammatory foods if you're eating that type of diet. Again, make sure it's really colorful and use a lot of like seeds and beans and fish, but that's a great diet. It's very similar to what we're talking about.
Here's a great one. How important is it for the patient to have a diagnosis from a doctor before starting a low histamine diet?
Yeah. So with starting any diet, right, I would say it's helpful to talk to your doctor about anything you're going to do for your health, right? So if you have diabetes and you're going to go on a ketogenic diet, right, like you have to talk to your doctor before you do that, right? There's lots of things you need to share with your doctor. So I do recommend people chat with your doctor. There's nothing harmful about going on a low histamine diet. You're really just eating whole food, I guess is the way to say it. Like you're eating food. You're just not eating a lot of the junk in food. So there's nothing harmful about it at all, but for sure, share any diet change with your doctor before you do it. Yeah.
Great. So one of our students says, unfortunately, I've been diagnosed with Crohn's disease this past summer with a disease that goes a little farther than just a GI tract problem. When being on a stricter diet help with relapses, sending it into remission for a while?
Yes. So with Crohn's disease specifically, so using an anti-inflammatory diet with a crossover with a specific carbohydrate diet. So this is, again, go see a dietitian or come see us so we can help you. Really helps with Crohn's disease. And then using a really good probiotic can be really also helpful. So I would say don't just go on this diet because the fiber amount might not be tolerable in a Crohn, depending on your Crohn's flare situation, because I do recommend a lot of fiber, right? Like fruits and veggies and beans and whole grains. So we just have to be careful with where you would be in a flare. But I would say, yes, find a dietitian or call me or our practice and we can help you find something, because there's a lot of diet stuff we can do for Crohn's for sure.
Have you looked into any research using CBD for inflammatory disorders?
No, I do not know much about CBD. So no, I did not do much research on that. I'm sorry, I can't help.
And can cutting out certain food groups such as dairy be unhealthy?
Yes, that is a super good question. So absolutely. If you cut out dairy and you don't replace it with any calcium supplement, then for sure it could be. So I usually recommend like a plant-based milk, like oat milk or almond milk, like pick a milk, right? There's so many. And what's nice about the nut milks or the plant alternative milks right now is they're doubly fortified. So you actually end up getting twice as much calcium from a cup of that versus a cup of cow's milk anyway. So definitely getting in a plant-based replacement is definitely recommended, because yeah, you don't want to be void of calcium. That would be terrible.
All right, we'll do one more and then we'll get back to your presentation. So
I also love oat milk. Sorry, I love oat milk. Yes.
Which vegetable do you think is the most beneficial to someone's diet in general, as well as to a low histamine diet?
Okay. So if I were to do a top pick, I don't know, there's so many. I will tell you my top 5, okay? Dark greens, kale, Swiss chard, like these babies are amazing. Onions, because of the quercetin, okay, and their sulfur. They help with your liver. They help with detoxification. Orange stuff, sweet potatoes, carrots, and then, well, I'm going to tell you fruits too, blueberries. So blueberries and mangoes are these are like my top fives. Like, eat these guys because they really complement your phytonutrients and then your inflammation part as well. Okay, so we'll take a hold on questions. There's plenty of time at the end too. I made sure to hopefully save time from the slides that I made. So basically what I put together and what I wanted to share with you today is that the low histamine diet has been shown to improve those DAO enzyme levels in many studies. So that's helpful, right? So if your body's, you've built up too much histamine reservoir in your body and you're spilling over into symptoms, going on the diet for a couple of months actually can help improve your enzyme levels, which is amazing. So you could go back to eating hot dogs and ketchup if you wanted to, and maybe you wouldn't have a weird symptom, a migraine to go with it. Or a lot of people complain about like red wine headaches and migraines. That's because red wine is one of the highest histamine foods you can consume. So most people are reacting to the histamine in the red wine, and their enzymes, like their DAO, are not functioning as well to metabolize it in their body. So there's genetic differences between people. The red wine is just really well studied because people get migraines a lot with that. But if we can get our enzymes to work better, we can eat more things. We don't have to have as restricted of a diet. So we could help with allergies and asthma and headaches and chronic hives. There's very good evidence for a low histamine diet in reducing chronic hives. Eczema and atopic dermatitis, interstitial cystitis, IBS, and arthritis. So the other thing to note is that when people have other food sensitivities, right, there's no good test for food sensitivities. There's no good science yet backing a food sensitivity test, right? You've got like allergy testing, and then you've got like, I've got some sensitivities, right? If I eat this, I get this weird something that happens to me. So meeting with someone like a dietitian can help you sort through what might be a sensitivity, right? Because we have to explore what you're eating. But the most common sensitivities, especially in people with histamine intolerance issues, are gluten and dairy, and then salicylates, which you may or may not have heard of. But salicylates are your natural plant protectors, right? So in any plant food, not any, but a lot of plant foods, the majority of plant foods, the plant makes a little protective compound called a salicylate, and it's like a natural defense for the plant. But some people react to that, and it gives them some funky symptoms. Or oxalates. Oxalates come in, like spinach is very high in oxalate, or deep greens is another good example. But not everybody has those intolerances too. So I'd say it's kind of like an art and a science at the same time to figure out if there is a food bugging you and how to make it better. But this is like my favorite slide, because I love to not just say, okay, don't eat this, don't eat that, don't eat this, don't eat that. That's like a terrible job. Like, who would want to do that? I would rather say, well, let's cut back on this, right? Not to maybe zero, but let's cut back on this, and let's add some of these things that are really going to be beneficial for your body. So whether it's prevention, like you could say, I want to prevent cancer in my body. I want to keep my body healthy. I'm an athlete and I work out a lot, and I want to decrease inflammation in my muscles because I get sore, right? Like, functional foods can do that same thing. So there's a lot of preventative aspects of functional foods, as well as what we're talking about is reducing the histamine response or inflammation. So black cumin is like the first example, and this one has been studied to reduce symptoms of allergic disease, and it stops the histamine release from the cells. So we call these mast cell stabilizers, right? So think of your cells that are going crazy, and it just holds them still, so they're not releasing so many inflammatory molecules or histamine. Garlic is an awesome anti-inflammatory, and it reduces that cytokine release from those cells as well. So that's a good thing. Ginger stabilizes those mast cells, right? So we have less inflammatory mediators coming out. Pea shoots are one of the only food sources of DAO enzyme, which is interesting, right? So like the little pea shoots that you would buy in those little boxes at the farmer's market or the grocery store. So then they also may reduce inflammation and allergy symptoms. Rosemary, so kind of most of your green, fresh herbs are helpful at decreasing the cytokine release, which when you think of cytokine, think of inflammation, I guess is a good pairing word. And it can decrease histamine release. Stinging nettles, which there's actually a supplement used for some people with histamine intolerance, because stinging nettle is so good at stabilizing mast cells, but otherwise people forage for them because it's like a wild food, kind of like if you eat dandelion greens, stinging nettle is one of those. And then onions, my favorite, right? They contain quercetin, which helps to stabilize that mast cell. So you can reduce some of that release of the inflammatory molecules. Holy basil, which is known as Tulsi tea. So holy basil is not like the basil you put on pizza or in like tomato sauce. It's a separate plant, but it does a really good job in lab studies of stabilizing mast cells. And then turmeric. You guys have probably heard of turmeric as being helpful, right, for inflammation. Like I feel like turmeric gets all the buzz when it comes to inflammatory things because it reduces some of that cytokine release. And it's often recommended for people with arthritis, but it's good for everybody. So if you have any form of inflammation, turmeric can be helpful. And then oregano and basil, right? Just like simple, normal herbs that we use all the time, they also reduce cytokine release. So next time you make a dish of chicken, add more herbs to it, right? That's a simple thing to do. Do more ginger tea, do more holy basil tea. Those are really good things you can do to just decrease your inflammation. So this is why food's so cool, right? Like food can do stuff. So I gave you guys just a case study. So I work with all sorts of different patients, but like this was like a good example of someone who came in with flushing, right? So redness and heat in the cheeks, interstitial cystitis, so that bladder pain and inflammation, fatigue, right? Fatigue's a big symptom of this. Same thing with like fibromyalgia, migraines, intermittent diarrhea, right? So it's affecting lots of systems in this person's body. Stress, they have a high stress job. We know stress is a trigger. They eat lots of leftovers. And then when they tried the paleo diet, right, which is primarily meat, and you eat meat for days, right, and avocados, right, like tons of these naturally high histamine foods, she felt terrible. I was like, okay, that's just helpful information. So we did a low histamine anti-inflammatory diet for 2 months, and she froze her leftovers, which was that big change. And she had no more migraines or hives or flushing or fatigue. Her guts stabilized. So diarrhea is really common when you have a histamine intolerance. And her bladder symptoms improved a little bit. So not fully, that was the last remaining one. So adding quercetin, which is that like bioflavonoid stabilizer in the onions, right? And vitamin C helped to further decrease the interstitial cystitis. And there's really good research on quercetin and that particular bladder inflammation. So doing kind of a mix of these things helped this person to feel a lot better. And then after a couple of months, we always try to liberalize the diet, right? So we're able to add back a little avocado, a little higher histamine fruit, like the citrus fruits, and a little chocolate, because chocolate is a very difficult thing for people to avoid. Like, I think it was like the first food I added back in when I was working my foods back in as well. I was like, chocolate, no, I need chocolate. But freezing leftovers was still a routine that this person would do. So, and that's just a case study. And I could write a dozen of these, right? So that's another way to do research, right? So when you're looking at all the different studies, and when I put my research together, I did a literature review, right? So you go on PubMed and you find what's there, right? You put in your search words, and I've given you guys a couple of sample studies at the end that you can look at. But sometimes, especially around histamine stuff, you'll find basically a case study as one of a research article, because it's kind of not a well-known thing. So a lot of the research actually is from Europe, because they understand histamine intolerance a little bit better, I would say, or have a step forward, have been looking at it a little longer. So these are the 2 studies that I put out if you were curious. The first one is a big review article, and this one's actually from 2020. I wrote my book in 2016, 2017. So there were like some review articles that I loved, that I used in my book, but this was a nice new update on everything. So you can look at that for more information, and it talks about kind of everything that I did as well. But if you look at table 4, which the link should take you to table 4, which, will they get the slides after, Emily? Or probably not?
If you want to send them to me, I can post them on our site.
Okay, I can send them to you. Just if you were curious, like, because that's a lot of stuff to type in. So then you could click on it. But table 4 showed a lot of good studies all lined up right next to each other to show the diet, how well it worked for improving those DAO levels in the gut, so you can process histamine better in your body. And then the second one is just a histamine-free diet for people with hives. So urticaria is hives. And it just puts 22 people on a low histamine diet and says, all right, who gets better, who doesn't, right? So that's the prospective study that they did. But the case review one is, or the review study, the first one's a really, really good one. So that is kind of the overview of everything. So hopefully it's giving you guys some good information, and I will take more questions. So my book is available also if you want to read more. There's a huge review section in the front, or I have some more information on my website. I've put some blogs up there so you can read more if you're curious about the information. And my email's there, so feel free to email me too. So what other questions do we have?
All right, let's get back to the questions. I'm going to ask you this one mostly because I want to know if you had heard about this, because I haven't heard this as a thing. But so there was a popular trend going on a few months ago saying if you rubbed gold jewelry on your cheek, if it turned black or gray where you rubbed, then it means you have low iron in your blood.
I have never heard of that.
I haven't heard of that either.
Yeah, I don't know. Yeah, I have no clue. I've never heard of that. I would have to Google it.
Something to look into.
Yeah.
Okay. I'm not sure. We talked about the vegetables. What foods do you recommend for people with high blood pressure and foods that have low sodium?
Yeah, so blood pressure is one of the most fixable conditions with diet, I would say, and there's so much good literature on that. So for lowering blood pressure, your best tool is to eat foods that are naturally high in potassium, which are fruits and veggies. So if you up your fruits and veggies and decrease your sodium, your blood pressure will go down because it's all about maintaining kind of that water balance in your body. So I would say double your fruits and veggies and decrease your salt, and your blood pressure will go down.
So I'm not sure, I think this must have been referring to one of your slides. If you're having some of these symptoms, is that a sure sign that you're histamine intolerant? So the symptoms that you spoke about, does that definitely mean that you're histamine intolerant?
Yeah, it's a mix, right? So if you go to a doctor, they're going to give you like 5 different diagnoses, like you have allergies and you have hives and you have IBS, but I'd say look at it from a top down. If cleaning up your diet can reduce a handful of those symptoms, right, and it's going to depend what you have. Like a lot of people have seasonal allergies, like that's a normal thing. I would say it doesn't necessarily mean that you have like mast cell activation, which is like the bigger one, right? But you might be a little histamine intolerant, so maybe your enzymes aren't working as well. But you're not going to get a lab test to tell you that, right? So you might just want to look at the foods in your diet and see if eating more off that anti-inflammatory list and less on that inflammatory high histamine list actually improves any of your symptoms.
Okay. How immediate are the reactions to the different types of triggers?
Yeah, so for a lot of folks, like flushing, like the redness in the cheeks is really immediate. Hives can be immediate or delayed, right? So hives are not super accurate. Same thing with eczema and like atopic dermatitis, right? It could be like, oh, wow, it starts progressing pretty quick, or it's the next day. Same thing with migraines. So they can be delayed, I would say, by like 24 hours is like a window I would give yourself, like, oh, I ate this and I think it bugged me, but I don't know until the next day. Gut stuff, if you have diarrhea after you eat something, and it happens all the time, that is a very good sign that your body is intolerant of it for some reason. Whether you have irritable bowel syndrome, like that's something else to explore, or there's something in what you're eating that's causing you an issue.
So Ruby agrees oat milk is the best. She seconds your motion. And then what type of diet would help someone with arthritis?
Yes. So following the anti-inflammatory lower histamine diet can be helpful for arthritis. And I guess the other way to call an anti-inflammatory diet without the histamine layer on it is the Mediterranean diet. So have you guys heard of like that as like a term, Mediterranean diet? So that's really what the cardinal anti-inflammatory diet is. Mine just throws a low histamine layer on top to be helpful for more of these specific conditions and, you know, wrap around as a person as a whole. It has all these conditions, right? So it's not just you have like this one problem. It's like you're a person as a whole. So you have to look at yourself as a whole system. Wow, there's like a thunderstorm here now. It's getting really dark. So yes, I would definitely try an anti-inflammatory diet, specifically adding turmeric, omega-3s, increasing fruits and veggies for arthritis, and olive oil.
How come some people have negative reactions to consuming dairy when it comes to their skin?
Yes. So it's partially a food intolerance. So you're a little reactive to the dairy protein, maybe not to a full level. Like if it's eczema, you get eczema after you have dairy. You're having a little bit of a reaction to it. So maybe try a plant-based milk and just save your dairy a little bit for a little fresh cheese, right? So like if you notice you are getting skin reactions or acne, same thing. The dairy association with acne has been a little more profound lately in the research. 10 years ago, it was like, oh, it's not that big a deal. And now they're actually saying, oh, wait, you could be having more of an issue. So I would just say find a substitute and test it out for yourself.
All right, great. What is the most common misinformation you hear about nutrition?
Let me see. So I think the number one thing is that people think dietitians are food police, and we're not, right? We're just here to help people. We're not here to judge people. So I don't care if people eat sugar. Like I eat sugar, right? I don't eat a lot of it because it makes me feel bad, but I eat some of it, right? So that's just a misconception. But I guess diet things, right? So trendy diets and misinformation about that, like the keto diet is not for everyone, right? Like the keto diet isn't going to solve all of everyone's problems, right? Like every couple of years a new diet comes out and then people like hone in on it, right? So I'd say as a whole, you want to make sure that you're looking at your personal needs and don't jump on like a diet bandwagon, I guess, right? So like an anti-inflammatory diet or Mediterranean diet, like that's never going to go away. That is like eating whole grains and veggies and fruits and beans and nuts and seeds and lean protein, right? That's a healthy diet as like a base. But be careful, I guess, of, what do I say? Not fad diets, I guess is what answer that was. That's the biggest misinformation, I guess.
And there's most information on the web about fad diets, right?
I know, but it's not good long-term. Please, everyone hear that. The keto diet is not good long-term.
How is black cumin different than regular cumin?
Yeah, it's a different type of plant. So the actual name of it's like Nigella sativa, sativa, I think is how you say it. And it has a way different fragrance. So if you look it up, black cumin, you'll see it's a completely different type of plant or seed from a plant.
So what are some food recommendations for a person that can prevent eczema inflammation after eating clementines or any citrus food?
So it's hard to prevent, right? So citrus can be a very big trigger for skin reactions for sure. That's a smart thing that you kind of paired together. And like psoriasis, if people have psoriasis, citrus is a very big trigger for that too. Usually I say avoid citrus and then just eat it every now and then, right? So like decrease your dose of it, or the quercetin might be able to help. So if you ate a lot of onions and a lot of cooked down apples, that might help, but the citrus definitely is an aggravator of eczema and skin conditions. So you might just have to reduce it a little bit.
As a nutritionist, do you help people also come up with an exercise routine or just help them with their diet? And if you want to take this opportunity, Leslie, to inform us all about the difference between a nutritionist and a dietitian, that conversation never gets old.
Yeah, sure. So I'm not trained as a personal trainer. So in general, I'll help people make exercise goals, I guess, or support them on their exercise plan, but I'm not being prescriptive about what I'm recommending them do. So usually it's like personalized meal plans and like, how do I help your health improve, right, for whatever your goals are, and give you some fun ways to eat and recipes to do so. So the difference between a nutritionist and dietitian is something that bugs dietitians, I guess. There we go. There's the number one bug, but it's only about dietitians. So dietitians is a basically protected term, meaning that we have taken a national credentialing exam. We are licensed by the state, and we've done this like internship to even get this national credentialing through taking an exam, right? Saying that we know everything about science and nutrition, or maybe not everything. We know a lot about science and nutrition. Anybody could be called a nutritionist. So you could take a 6-week course online and it says you're a nutritionist at the end. So it's not a protected term. And like what I do, I bill insurance when I do patient visits. So you can't be a nutritionist and like bill insurance, for example, which is what I do. Only dietitians can do that, or naturopaths can do that. So I guess dietitians can call themselves nutritionists, but they like dietitian better because they think it means like I have science behind me, right? And I've done all this work and you can trust me when I'm answering questions because I know the science behind it. Whereas if you just ran into a random nutritionist, they might not be able to give you the clearest answer or the most accurate answer to help your health problems, I guess. And the other big thing I think about is dietitians help you with more complex medical issues, right? So if you're a health coach, you counsel people on a general healthy diet, right? Like that's totally fine to do, and you help people meet goals. Some health coaches might call themselves nutritionists as well. But a dietitian will help people with high blood pressure, with eating disorders, with diabetes, with gut issues. Like we really dive into when people have a lot, bigger health issues, what's the appropriate diet and how do we help you follow that so you're not miserable when you're trying to improve your health at the same time? So yeah, I'm just gonna turn a light on. It's so dark in here.
I see it getting darker and darker behind.
Sorry, it is so dark here. I can't believe it. Okay. All right.
Okay. Are supplements healthy for picky eaters?
Yes. So depending on what's missing, right? And so a dietitian, again, can help you look through your diet if you're a picky eater or your kid's a picky eater. I will often recommend a multivitamin to supplement because they're made to supplement, not to like replace healthy food while we're working on getting other healthy foods in the diet. But yes, in general, I do often recommend a multivitamin when we have picky eaters.
What happens if the diet that is given causes the person to break out with rashes and hives, or just overall creates sort of that buildup of the reaction?
Okay, so I guess there shouldn't necessarily be a buildup unless you're eating a food that your body is just intolerant of, right? So if you were, let's say you were trying to try this diet because you had hives or rashes, right? You should see a reduction, and the scientific literature for the diet and evidence of the low histamine diet would show that it should improve it. If for some reason you started eating, I don't know, a bunch of one thing and you're like, oh my God, it's getting worse, then maybe it was too much of one thing, I guess would be what I would say. So working, again, it's always coming back, work with a dietitian because they can really help you sort it out of like, because you don't want to be overly restrictive for too long, I guess is always the worry that we have too. So whenever we're trying to say like, all right, what's bugging you? We don't want to keep it out for too long because yes, it can lead to nutritional deficiency if you're not doing it correctly, right? And you don't want to omit big food groups for a very long time, like that dairy question, because you could be deficient in calcium and that would be a terrible thing. So I would say it should make you better, but if not, consult a dietitian and they can help you figure it out.
Because of the virus, can you do nutritional counseling appointments over the phone?
Yeah. My entire practice has moved to telemedicine and it's actually worked really well, which is great. So yes, all of my practice's appointments are over the phone or with Zoom. We have a HIPAA compliant Zoom. Yeah.
I had shoulder surgery a few weeks ago and I was wondering if there are foods to help with healing.
Yeah. So for healing, especially, I don't know if it was muscle tissue they probably had to cut into for your shoulder or not, having adequate protein in your diet's a really good one for healing. So is zinc. So make sure you're eating some dark meats or some pumpkin seeds or, I don't know, like dark fish would be another really good one. But zinc's another really good healing one. And definitely don't try to lose weight when your body's trying to heal because that would definitely make it worse. So make sure you're eating adequate calories is another good one.
Great. Is the over-releasing of histamine caused by a mutation in mast cells?
So it's not necessarily mutation. So something goes wrong, right? Which is like mutation. Like that's like mutation. It means like something kind of goes wrong. So usually it means that your enzymes, right, aren't working well enough. So they can't process out that histamine. So you're just building up too much, or the mast cells, you have too many of them. They replicate too much, or they're just overreactive all the time. So it's not necessarily a mutation, but we don't really know what causes it, right? Like what causes it to over-replicate or what causes them to go crazy, right? We just kind of get overstimulated by like scents or sun or heat or cold. So if you have triggers at you all the time, they're kind of always shooting off, right? So think of if you were exposed to like an allergen all the time and you were allergic, that's kind of what the mast cells do. They kind of just get a little overworked, and that's why there's so much histamine.
I had an alternative medicine class which suggested to sometimes combat inflammation by using an inflammatory food. Do you know why this would be suggested?
Yeah, so I'm not an expert, but that's like homeopathy, right? So homeopathy is something sometimes like naturopaths might use. And again, I'm not an expert in this, but they give you like a microdose of something that would be inflammatory or histamine provoking so that your body reacts less when you encounter it in the environment. So that's probably what they were talking about, more like a homeopathy approach to the health condition is probably what I would assume they were talking about.
So do you mean like before the inflammation, you do a microdose, or to combat the inflammation that's already occurring?
So again, I'm not an expert in this, so it's only from what I've heard. So they just do it at various points in the day. So it's not just like food. You take literally like a homeopathy tab of like histamine and say, my body's not going to react to this histamine that I'm literally putting in my body because I get used to ingesting it over and over and over again, is my understanding of it. But I don't know exactly about putting in an inflammatory food. Like eating bacon isn't going to make you not react to bacon, right? Like when it comes to like a food that's inflammatory and high in histamine. So I guess the homeopathy is the only thing I can kind of think of that would fit that one. Yeah.
I always hear about the paleo diet and have people rave about it. Is it really that good of a diet?
So the only amazing thing about paleo is that it's so high in fruits and veggies, right? So think about like, yes, the meat part's like kind of high, right? So that's what we want to cut down a little bit of, but I like to tell people there's nothing wrong with whole grains, right? Like oats and brown rice and quinoa, like these are good things for your body. And that's the only reason that like paleo makes people like dietitians sad, is like, we're cutting out big food groups like beans and whole grains that we know have really good evidence behind them for being good for heart and for cancer prevention and for inflammation. They're actually really good. So I usually recommend like modified paleo, like eat a cleaner diet, right? Anti-inflammatory, but put some grains in, put some whole grains in and some beans. But if you have Crohn's disease or an inflammatory bowel disease, the specific carbohydrate diet is similar to paleo, just as a comparison. There's a little difference, but a lot of people do find, at least with Crohn's disease, grains do bother them and sugars bother them. So that's just like modified. So what the best thing about paleo is, there's some really cool recipes that are really nutrient dense, right? So paleo gives you a lot of nutrient dense recipes, tons of veggies, tons of sweet potatoes. So that's one really good thing. So I wouldn't say like go on the paleo diet, but like a lot of the recipes are actually really awesome.
Right. How much of our knowledge of anti-inflammatory food came from folk remedies?
Remedy. Well, I don't know. So I wouldn't say folk remedy. So a lot of nutritional studies are epidemiological. So they look at populations, right? So if you look at like, why do you think the Mediterranean diet is called the Mediterranean diet? Because they looked at people in the Mediterranean. They're like, why are these people so healthy? Why do they not have arthritis and heart disease? And why do they live till they're 100? So they look at population studies and say, then what do you eat? And then they do more studies on what they eat. So a lot of nutrition research is done this way because they're like, wow, there's pockets of really healthy people all over the world. Like, what do they eat? So that's where we know olive oil is so good, right? Because we look at these big population studies. So I wouldn't say it's like folk remedies per se. And like, I'm not an herbalist either, right? So an herbalist might say like, oh, well, all the things you just said for functional foods are folk remedies for this, right? Like, so I'm not an herbalist. So I wouldn't know how to answer that part of it. But I'd say we look at diet culture and then we get the science from it to back it up. So maybe not folk remedies, but I think we look a lot at what food cultures are, and then we look at the science of how it works.
What are the nutritional differences between sprouts and microgreens?
Okay, so they're both super nutritionally dense. They're probably pretty similar, actually. So microgreens they're just baby plants is what microgreens are. And sprouts are just the sprouted seed, right? So you grow them differently. So the microgreens are grown like you would grow a plant. You just trim them all when they're babies. The sprouts you would sprout in a container just because they're moist and you're sprouting the seed open. So I would actually have to look up the antioxidant difference, but I would say they're both really good. I almost might go for microgreens, actually. It's probably more nutritionally dense than sprouts. That's my gut guess.
I've heard that turmeric is most effective as an anti-inflammatory when eaten with black pepper. Is that true, or is it always the case?
Yes, so absolutely. So the active potent anti-inflammatory in turmeric is called curcumin, and it is more readily absorbed with black pepper. So if you want to enhance your absorption of turmeric or curcumin, yes, have black pepper with it.
In your opinion, what is the most nutritious nut milk?
I would say the one with the most nuts in it, because what's so funny about almond milk is they literally, it's not water, I guess is the way I describe it. Like they suck out, there's no nuts in there. There's 2 or 3 maybe for the whole thing, which is why the calories are so low, right? The calories is 30 or 40 calories for almond milk. So if you find one where it's just pureed up cashews or I really do like flax milk. Flax milk gives you really good omega-3s. So it's not a nut milk per se, but I love flax milk because it gives you omega-3s and it tastes like vanilla, right? So that's a good one. And then I don't know, oat milk's my personal favorite, but that's just because it's creamy and delicious. So.
Can you also explain the nutritional differences between broccoli sprouts and broccoli, or explain the general difference in a sprout stage of a plant versus the mature and ripe plant?
Yeah, so the baby plants, right? So the sprouted broccoli or the microgreens have a very high concentration of phytonutrients, so those anti-inflammatory compounds. So, I couldn't tell you the exact vitamin C comparison or anything like that, but it is a very high concentration of it. But you have to also think about your amount, right? So you might have to eat a cup of broccoli to equal the antioxidant load of a quarter cup of microgreens, right? So maybe it's just I only have to eat a quarter cup of that, and then I get as many antioxidants as this whole head of broccoli, right? So you can look at it from just adding more benefit to your diet.
Cytokine storms are linked to poorer prognoses and a higher likelihood of death in COVID-19. Are you aware of research on diets that suppress cytokine storms and result in better outcomes, specifically with COVID?
Yeah, so in general, again, there's no good answer, right? There's no solid answer for that because everybody's body is reacting a little bit differently, which I think is what is making this thing so scary, right? But in general, eating a diet really rich in antioxidants and then some of those functional foods that are helping your body to stabilize the release of cytokines isn't going to hurt. So can we say, yes, it's going to make sure your body has an appropriate response to COVID-19? No, but having ginger and garlic and onions and things high in quercetin are also helpful, right? The onions and apples, those are helpful things. And there was actually an interesting study. I get all the listserv things. So hesperidin, which is actually in citrus, so not for histamine intolerant folk, but for other folks who can eat citrus, hesperidin was actually found to be helpful in blocking some viral replication. So I think it comes down to eat good foods to keep your immune system strong, and you're going to give yourself a better chance of having a better response, right? If you get sick. So we can't say take this and it's going to lead to this result, but I think all of the studies will say have a good diet, eat fruits and veggies and good herbs and spices, and try to keep yourself healthy. So self-care too, right? So all of those things I think come into play to keep your immune system as healthy as it can be. Because it's scary.
I think that's a good point because we think about, being ready to fight, right? Viruses, inflammation. So being nutritionally sound to begin with before you get sick is really important, right? But not just always reactive, not always trying.
Exactly. And it's not like you're going to be popping emergency, right? Yes, maybe vitamin C might be helpful, maybe not, but it's having the base. And think about this, because I didn't mention this, 70% of your immune system's in your gut. So if your gut's a little off, right, you have, irritable bowel, or you have diarrhea every now and then and a poor diet, good diets and fiber and fruits and veggies feed the good bacteria in your intestine, and they keep your immune system stronger. So make sure your gut's taken care of, and you eat good food, because you're right, keep your immune system at a good spot. That's the best we can do.
Well, that was the last question. I just want to say I truly miss conversations with Leslie about good food and recipes and finding new fun things to make and eat. And you can tell just by the way she talks about it how excited she gets.
Sorry, I love food, right? What can I say? I love food and food science, right? It's good stuff.
Any last questions? All right. Well, thank you everybody for your great questions. And thank you, Leslie. This was a great presentation. And we will see everybody back here next week.
All right. Thank you, guys. Bye. Bye, Emily. It was so nice to see you.
You too.
Take care.
Thank you.